TMS Plus is an immersive therapeutic ecosystem. It is a coordinated treatment environment where the clinical technology is designed to move in sync with the patient. At its core, the treatment acts as a spine. We wrap MRI-guided targeting, AI-supported therapeutic content, and a multidisciplinary clinical team around that central intervention. This infographic outlines the orchestration behind the scenes. Psychiatrists, psychologists, and technicians use a shared digital platform to monitor progress and integrate virtual reality into your recovery. To synchronize these layers perfectly, every patient selects a specific structural architecture for their care. To maximize the clinical return on this level of care, you need to identify which of these frameworks best aligns with your practical reality. This presents a practical challenge. How do you select a treatment schedule that fits your routine without wasting time or emotional energy? The process begins with a shared entry phase. This ensures that every patient receives the same foundational clinical assessment, MRI brain mapping, and financial planning before a single session begins. From there, the path opens into 3 distinct options: accelerated, signature, or modular. These are parallel tracks. You choose the one that fits your needs. The goal of the shared entry phase is to generate a targeted recommendation for exactly one of these columns. Investing this time in assessment upfront prevents you from entering a treatment schedule that might be mismatched, disruptive, or ultimately ineffective for your lifestyle. The accelerated pathway is built on intensity. It condenses sessions into concentrated daily bursts to trigger a rapid therapeutic response. This timeline defines the track. It starts with a heavy block of treatments, followed by a visible temporal pause, and concludes with a second shorter burst. That gap represents a deliberate interval of roughly 1 month, where the patient returns to normal life between blocks. This design provides rapid therapeutic immersion. It significantly reduces the total number of weeks you spend in active treatment sessions. The practical trade-off is the demand on your time. During those active blocks, you will need to clear your daily schedule almost entirely to accommodate the multi-session format. This path is optimized for speed. You trade extreme daily intensity for a much faster completion date. The signature pathway prioritizes an uninterrupted daily routine. It replaces the burst model with a steady, continuous progression of care. As the diagram shows, there are no gaps here. The treatment starts at full frequency and then gradually tapers down into a maintenance phase. This represents a seamless transition from initial stabilization directly into a gradual weaning course lasting several months. The clinical focus here is longitudinal stabilization. It provides a constant, steady therapeutic presence without the interruption of a 1-month break. This is less disruptive to a standard workday, as you only manage 1 session a day. However, it requires you to be geographically anchored for a long-term commitment. If you value a predictable, smooth routine, the signature path offers steady momentum in exchange for a longer duration of care. The modular pathway is designed for clinical complexity, specifically for patients dealing with intertwined symptoms, like a combination of depression and OCD. Every patient on this track commits to an initial 5-week stabilization phase. We intentionally delay the decision about the second half of treatment. This delta structure represents the adaptive logic. You follow the main trunk until a decision node, splitting into 3 tailored substreams. The medical team observes your brain's response, only selecting your final continuation branch during the final week of that initial phase. This allows for a mid-treatment pivot. The team can shift focus toward aggressive depression weaning or transition to symptom-specific OCD care based on your improvement. The trade-off is predictability. On day 1, you have to accept that your total timeline and final package costs aren't yet locked in. The modular path provides the highest level of clinical precision. You trade initial certainty for a plan guaranteed to adapt to your biological response. Transitioning from these concepts to your actual care requires a practical look at your own constraints. We can construct a decision matrix to align these 3 pathways with real-world scenarios. The accelerated column is the fit for regional patients, traveling executives, or anyone who can dedicate short, isolated blocks of time to intensive care. The signature column is for local patients with straightforward symptoms who value a continuous, uninterrupted daily routine. The Modular column is for patients with complex symptom profiles who need the medical team to test their biological response before finalizing a plan. While this matrix is a tool for your planning, the final pathway selection requires balancing these scheduling realities with a psychiatrist's clinical assessment. Ultimately, your choice optimizes for either time flexibility, routine consistency, or adaptive precision. Regardless of the track you choose, the patient experience remains clear, supported, and personalized. The value of the TMS Plus ecosystem lies in this treatment architecture, a system sophisticated enough to be designed entirely around the individual.